Hello friends, good morning. In today's session, I will demonstrate you the instruments which are used for tonsillectomy and adenoidectomy. We will take instruments one by one. The first instrument that we will require is the Boyle-Davis mouth gag. So you can see this is the frame of the Boyle-Davis mouth gag, and this portion will face the surgeon and this side will face the patient. And you can see this it comes with this tongue depressor. So you can see there are different types of size of different tongue depressors. As per the age of the patient, we can select the tongue depressor, and this tongue depressor is to be introduced in this frame. So you can see this latch is there. So if you have pressed and it's another end comes here, so you can see that this is moving. So once it is released, then it will lock the complete this Moldav's gag. And for introducing, you can see now this side will face the patient. Again, this side will face the surgeon. So this is to when we are introducing, you will have to press it so that this will go inside, and then we can introduce it. So this portion will elevate the lower jaw and it will elevate the tongue. And this lower portion, it will get engaged in the upper central incisors teeth. And then when we are introducing, we'll have to close it and then we introduce. And we should take care that we should not damage the upper lip as well as the lower lip. They will not come in between this retractor. So you can see when we are opening, you'll have to again press it. And a maximum that the patient mouth allows, that we can open so that we will get sufficient space for the surgery. Now after introducing this Boyle-Davis mouth gag, we need another instrument, and that is the Dauphin's bipod. Now these are the Dauphin's bipod. You can see. Okay, so they will be assembled like this. So you can see this bent end of this tongue depressor. It will go in this. Right, so it will be like this. Complete this unit will become like this. And then we have this macarons by rod. You can see these sockets, they are there on both the sides. So this lower end of this Dauphin's bipod, they will get fit here. Okay, so you can see these slots, so they will get engaged here. So this is now the complete unit. So these are the Dauphin's bipod. You can see this macaron rod, and then you can see this your Boyle-Davis mouth gag. So this is the tongue depressor. This portion will engage the upper jaw or upper central incisors, and this portion will lift the lower jaw and the tongue. So this is the entire unit. And then, as per the indication of the patient, either we can remove if patients need removal of adenoids as well as the tonsils, then usually we first remove the adenoids. Now I will show the adenoid curate and everything. So mouth should remain open when we are performing the surgery of the adenoidectomy as well as the tonsillectomy. But first, as I told you, we will do so this I am keeping it here. And then first we should remove the adenoids. Now these are the two adenoid curates, you can see. St. Clair Thompson adenoid curate. Now this is plain curate and this is cased one. So you can see this is the case. You can open the case like this. So this case, you can see these fangs of the case. So when we are removing the adenoids, what we will introduce it like this and hold it like the dragger. And then we sweep it like this. So whatever the adenoid mass is there in the nasopharynx, that will come. And when we are sweeping, curating, at that time we should flex the head of the patient. So that will avoid damage to the cervical spines. And this case will not allow the adenoid to get dislodged from here. So they will get lodged. And then after using this, then we can use this plane. So this will help in removing the remaining part of the adenoid, and especially the part of the adenoids which are close to the eustachian tube, that we can remove with the help of this adenoid curate. And then even this cage also we can remove it, but you should know how to. First we'll have to open this like this. After opening, then you can see this slot. This slot is to be lifted, and then we can remove it like this. You can see this knob. So this knob will go in this point. And when we are opening and closing, at that time we should keep in mind that we should keep it open. And then again we can put it. So this is the way we open this cased part of this adenoid curate. Then after removing the adenoid curate, then we remove the tonsil. We will perform the tonsillectomy surgery. And the first instrument that we will need is the tonsil holding forceps. So this is the tonsil holding forceps. You can see this fenestra, two fenestras are there. Both the fenestra, they are of different size. Okay, so this is lower size, this is larger size. And then what we will hold the upper pole of the tonsil, medially and little superiorly. Okay, after retracting the tonsil with this tonsil holding forceps, many types of the tonsil holding forceps are, but most commonly used is this Dennis Brown tonsil holding forceps. And then we use this VAG forceps. So with the help of this, we can put the incision just at the anterior pillar. You can make the incision, and then we retract the gradually with the help of dissector. Then we will need the help of dissector. Now this is the dissector. So we'll separate the tonsillar capsule from its bed, gradually holding it. And it's another. This side is the dissector, and this side is the anterior pillar retractor. You can see this C-shaped structure. So with the help of this, we can retract the anterior pillar and examine the tonsillar fossa completely. And then in some cases, even we can retract with this help the soft palate if need be, so that we can see the adenoids clearly. So this portion will get engaged in the free border of the soft palate, and then we can retract it. But we should be very gentle, otherwise we can give rise to trauma. Then after removing the tonsil, then removal at the last step will be the removal of the tonsil. Gradually we'll have to dissect the tonsillar, this capsule from its bed, and the superior pole that should be fully dissected, and posterior this your tonsillar pillar also from it should be dissected. So ultimately we'll remain the pedicle that is attached to the lower side of this tonsillar fossa, and then that pedicle we get engaged here. You can see this is the so we can open this. You can see this wire, thin wire. So this wire will get engaged in the tonsillar pad, and then you can see in this way we hold the tonsil. So this upper fenestra you can see will go the thumb, and then the index finger and the middle finger, and then gradually we'll close it. So when we close it, what it will do, it will cut the pedicle of the tonsil. It will crush and cut both. So that crushing will lead to less bleeding. Okay, first we'll have to open it, and then gradually. So this tonsillar snare, Eve's tonsillar snare it is called. So you can see this is the channel in this that will come this your snare wire, and gradually you should close it, and then we will dissect the we can remove the tonsil. Then this is the Yancourt speculum, Yancourt suction tube. So with the help of this we can suck the secretions and the blood and whatever they were in the oral cavity that comes in the oral cavity or oropharynx. And you can see these holes, this can be removed. So this is, you can see this is very smooth, so it will not give rise to any trauma to the tonsillar bed. Okay, so with the help of this we can remove this tonsillar secretions, bleeding or the secretions, whatever they are there. Then we should achieve the hemostasis. For achieving the hemostasis, what we'll have to do, we'll need these two instruments. This is the straight artery forceps, tonsillar artery forceps, and this is the curved artery forceps. This curved artery forceps, they are for the other types also. At some places this type of artifacts of they are available, but this is good. So what we will do, first we will hold the bleeding point with the help of this. Say this is the tonsillar bed. So you can see that I hold this, but it is very difficult to tie. So for tie, what we will do, we will apply another forceps, and then here we can ligate the vessel. So our that ligated suture that will come here, and then we will be able to ligate it. So without these two, it is very difficult to ligate. Only with this we will not be able to ligate. You can see there is no space for tying the this ligature. And after this, then this is the space. Through it we can pass the tie, and we can ligate the bleeding vessel. Then after removing the adenoids, as I was telling with the help of the adenoid curate, we pack the nasopharyngeal area, and once the tonsils they are out, then we can remove that pack, and most of the time the bleeding is stopped. There is no bleeding in the nasopharyngeal area, so that will stop. So these are the main instruments of this tonsillectomy that I showed you. Thank you.